Good evening, and let's have some fun. So, believe it or not, I have personally taken four different disease modifying therapies for multiple sclerosis. And it's just a funny thing. These medications somehow end up in your office. Patients change medication, and they somehow think that we can give them to other patients or recycle them in the pharmacy. Of course, we cannot, even though they're very expensive. It's illegal for us to do that. So they just sort of sit there, and there's nothing we can do. We can't throw them away because they have sharps sometimes. We can't give them back to the pharmacy. And so, how can you not take them? How can you not try them? I mean, you have patients complaining to you about the side effects, and they're just right there. You just have to know. And so the curiosity got the best of me. Now, these are somewhat dated stories. Some of these medications are a little bit older and not as commonly prescribed anymore. But hopefully, you can learn something from my experience, or at the very least, be a little bit entertained. So, the first medication I tried was Copaxone, which is glatiramer acetate, and it's injected under the skin subcutaneously. And the particular formulation I took was 20 milligrams once daily. And I injected this medication into my abdominal area, and I just had this massive red welt. It was like a 5 inch by 5 inch circular welt. It was tense, it was swollen, super painful. I was just thinking to myself, what an idiot I am for injecting this medication into myself for a disease I don't even have. Just the sensation of my shirt on top of the skin for hours and hours was bothering me. It took forever to go away. And I can't believe that people take this medication every day or 3 days a week for years. And it's a funny thing because some people really do tolerate the medication incredibly well. And as an aside, I actually have this one patient, and she actually managed to take advantage of another side effect caused by Copaxone. So, Copaxone can cause a side effect called lipoatrophy, where it damages the fat cells. And one or two injections, it doesn't really cause any problems. But if you inject for years and years, you can damage the fat cells and get some dimpling. And it's just a cosmetic issue. It's not serious, but some people are bothered by it. Anyways, this particular patient was able to inject in very precise places in her abdomen over years and years, and she was actually able to carve out a six-pack into her abdomen. And she also injected into her upper arm and created like a triceps cleft to make herself look more muscular and defined. It was one of the most impressive things I've ever seen. But anyways, I'm just trying to make the point that some people really do tolerate it well for years, and this particular patient did extremely well and was doing great on the medication. Anyway, the next medication I tried was Avonex. Avonex is beta interferon 1A, and this particular formulation is an intramuscular injection, under the muscle injection once weekly. And it's an interferon, and interferons are proteins that are naturally secreted by the liver in response to viral infections. So the typical side effects people get are things like chills and muscle aches and rigors, and they feel lethargic and almost feel like they have the flu. And for some people, it's quite severe. They could be laying in bed and they have to take it in the evening and they can't do anything the next day. But for me, I injected it and I had absolutely no side effects. Not only was the injection relatively painless, but I did it while I was at work. I walked home. I was very fit at the time. I changed clothes into running clothes. I went out for a run. I even was able to do hill sprints. I had no side effects whatsoever. It was just absolutely nothing. Which is kind of funny because I would perceive my patients to believe that for the most part, Avonex is much worse than Copaxone in terms of how well tolerated it is. But for me, it was definitely the opposite. The next medication I tried was Rebus. Now, Rebus is an identical medication to Avonex, beta interferon 1A, but it's a different formulation. It's a subcutaneous under the skin injection, and it's given 3 times a week. But again, these injections were painless, and I had absolutely no side effects whatsoever. It was completely fine. The last medication I took was Tecfidera, which is dimethyl fumarate. Now, with Tecfidera, you're supposed to start 120 milligrams twice a day for 1 week before going up to the full dose of 240 milligrams. They also recommend that you take it with a large meal, maybe a protein-rich meal, just to kind of slow the absorption to reduce some of the side effects. Of course, I didn't do any of that. I just took the full 240 milligrams on an empty stomach because I wanted to feel the side effects. And I had horrible side effects. I mean, I just had flushing all over the skin. I was like a lobster, just a total sunburn, feeling very uncomfortable, the itchiness of your shirt on your body. I looked ridiculous. I mean, people were laughing at me. I did it while I was at work, but after I was done seeing patients, and I was walking around the office, and people were just laughing at me. It was hilarious. I did not have any gastrointestinal side effects or anything else, and it went away pretty quickly, maybe 90 minutes, I would say. And afterwards, I felt completely fine. So that is my experience with the four disease modifying therapies. Please post in the comments below, what drugs did you take for MS and what side effects did you experience?